Minister, I'm deeply concerned about the state of transgender healthcare services in this country. In 2022, Ireland was found to have the worst trans healthcare services in all of the EU by TGEU. The only dedicated gender clinic has about 2,000 people on the waiting list. Only 162 removed last year. Waiting times are between 3 years to 10 years, which is not acceptable. The Journal recently published quite a harrowing reports into their services. One patient described feeling traumatised after going through the services, another one saying it felt like an interrogation. People are being forced to go online to access HRT. Minister, have you seen these reports? Will you commit to reclassifying trans healthcare as sexual health instead of mental health, as recommended by the WHO, and can you provide an update on the Dáil and model of care?
Minister to respond.
The programme for government commits to ensuring a transgender healthcare service that is based on clinical evidence, that is based on respect, inclusiveness and compassion. A new model of care is currently under development to strengthen and standardise care, ensuring safety and best practice. My department has provided €770,000 in budget 2025 to support this. The clinical lead has been appointed, a cross-specialty clinical advisory group has been established, and a review of the evidence base is also underway. A community pilot project to identify the needs of children and young people who are gender questioning will also commence in the coming months. The model of care will be developed in a consultative way, engaging with healthcare professionals in gender healthcare, stakeholders including people with lived and living experience, and the families of people who use and receive support from services. I think it is important that the HSE is given time to develop a model of care that is based on the best clinical evidence and will deliver the best outcomes for persons with gender dysphoria based on respect, compassion and understanding. As the Deputy may be aware, the World Health Organization International Classification was updated to its current version, ICD-11, in 2019, and gender identity-related health diagnoses were moved from the mental and behavioural disorders chapter into the new conditions related to sexual health chapter. I think it is important to note that the ICD-11 is not a clinical guidance for gender healthcare as such. It is a system classification where criteria for various diagnoses are described. But I think from our perspective, what we want is a holistic, compassionate, respectful service at every stage of a young person or an adult's journey, at every point of contact. And that is the approach that I will take. That is the approach that everybody in the Department of Health, all of the Ministers of State, will take in relation to this issue. And I know that is the approach of this House.
Thanks, Minister. Deputy Rice.
Thank you, Minister. I think the pace of change here is far too slow. This issue has been going on for many years now, and what we need is an acceleration, and we need the delivery of high-quality services for people across the country. The current system is operating on an outdated model. As you say, in 2019, the World Health Organization reclassified trans healthcare as a sexual health issue. Despite this, the services are still being treated here as a mental health issue. Being trans is not a mental health condition, but not having access to these services does have an impact on people's mental health. Trans healthcare services are life-saving services. In 2013, Transgender Equality Network Ireland study found that 78% of trans people had considered suicide. But after they access services, that dropped to 4%. So these are crucial and life-saving services. And Minister, you spoke recently about a framework to think about services of some that are operating well, some that need to be improved, and some that are causing harm. I genuinely believe that these services are causing harm to people and need to be improved.
Well, Deputy, I fully hear what you're saying, and your feedback is very, very important to me, as everybody. But also, and I didn't congratulate you on your new position as Chair of the Health Committee, and I look forward to working with you on this as many issues. And I think we have very much a similar approach to these issues. I think it's important to recognise demand for gender healthcare services has increased, and I acknowledge that the current public services are not meeting people's needs and also not meeting their full range of needs. It's for that very reason that the HSE is developing the new model of care for gender healthcare services. I think what's important, you're absolutely right to identify that it is not a mental health condition. Of course not. What absolutely is the case is that a multidisciplinary approach offers the best pathway of support to somebody. A multidisciplinary approach including endocrinology, psychology, appropriate counselling, psychiatry if or as needed, and the support of social work if required. And that would certainly be the approach that I hope the model of care will lead towards.
Deputy Rice.
Much, Minister. I fundamentally believe that the new model of care must be in line with those WHO guidelines. It must be under an informed consent model and delivered in the community, which I think is crucial. And there are models in place in other countries that we can look to. Look to Australia, look to New Zealand, look to Iceland, Malta, Canada and parts of the United States who are already operating this model of care. And I think that's where we need to be looking for best practice. And as I said, the development of this model of care must be accelerated, and crucially, it must be done in engagement with the community and with people who are directly affected and their families. And I think to date that hasn't happened, and I think relationships with the National Gender Service and the community are very, very poor, and they need to be improved. And people need to have a say in these services, and the voice of the people needs to be crucial in that. And crucially also, it needs to align with the core principles of Sláinte Care, which was community-based and patient-centred, because ultimately here we're dealing with people's human rights and the right to healthcare, because ultimately trans rights are human rights.
Minister, to conclude.
Deputy, I agree with you, and that person-centred approach is what we want to get to. Everybody is entitled to healthcare, and I just agree with you completely on the points that you've raised, and I hear your very important perspective on the National Gender Service, and I think it's very important that it's articulated here tonight, and I very clearly hear you in relation to that. I don't wish to get distracted by the World Health Organization piece, which is slightly more technical and doesn't sit against what we're speaking about in any way. It's not a clinical guideline, it's a classification system, and I can give the Deputy more information on that by way of background to be of assistance. I just don't think it's going to cross over the model of care that I certainly want to get to, which sounds very much like what I think the Deputy is describing. And I don't think there's any reason to be at cross purposes on it. Perhaps we can speak about it in more detail. But the model of care that we're talking about is intended to be based in a consultative way, putting people at the centre of it, with, say, stakeholders, healthcare professionals, and crucially those that use and receive support from the services and their families.
Thanks, Minister. Anish Bogamish.